Hey there, everybody. Tyler Pettit here with Medicare in the Mitten. Here to talk to you today about Medicare Part A. What is it? What does it cover? What's it going to cost? Those types of things. Doing my best to give you a Reader's Digest version, if you will, of Medicare Part A, and hopefully you walk away from it feeling like a mini expert. So really, let's get into it. Medicare Part A. Medicare Part A is your hospital insurance, right? Plain and simple, it is your hospital insurance. Okay, again, Part B, your medical, we'll get to that in other videos. This is focusing on Part A, your hospital insurance. So for those of you that are already on Medicare, it'll say that on your red, white, and blue Medicare card, Part A, hospital. It only applies in the event of an inpatient hospitalization or a hospital admission. Okay, so if you need to think of being admitted to that hospital for Medicare Part A to apply, think of it that way. Okay, so for the most part, individuals in this country will have a premium-free Part A that will apply to you if you've worked in this country for 10 years or 40 quarters, paid those Medicare taxes. You've seen them as a line item on your payroll stubs for as long as you've been working. You'll see that you've paid those for all of your working life. And now you get Part A for free because you paid those taxes for all that time. How lovely is that? Okay, so it also applies, by the way, just a quick caveat to that. If you didn't work 10 years or 40 quarters, but your spouse did, you're okay. You're fine. Okay. You also get that premium free Part A. Okay. So that's the cost. Now, I don't want you to think everything with Part A is free, because how it functions is Part A has a deductible. It is not your typical healthcare deductible, meaning it's not calendar year. Okay. It's going to be more of a per benefit period deductible, almost like a per occurrence deductible. It's going to operate similarly to a deductible might on your car or your home. So when I say per benefit period, meaning if I go out to shovel snow because we got a random storm in March, which we tend to do around here, and I throw my back out, I have to go spend 2 days in inpatient hospitalization. I'm going to have a deductible apply for that. 3, 4, 5 months down the road, I'm out doing some landscaping work now because the snow is finally gone, and I can start working on maybe some raised garden beds or something. I hurt myself doing that, and I have to go have another hospital stay. A new deductible is going to apply for that Part A. Okay, so again, it's not calendar year. All right, it is a per occurrence, it is a per benefit period deductible. This video is being made in 2026. So our deductible is $1,736. Okay, that is the Part A deductible, meaning that would have been the one that applied when I got hurt in March. It would also be applied when I got hurt in June. Okay, historically, it has gone up time over time. So as you can see, it continues to go up, whether that be $40, whether it be $80 here. You're going to see that increase happening time over time for that Medicare Part A deductible. Okay, so again, that's applying to an inpatient hospitalization. The other main thing that Medicare Part A covers for you is what's known as a skilled nursing facility stay, also called a rehabilitation center. Okay, so you had your hospital stay, and now you need to go get some more specified work done so that you can get on your feet and get out and do some things, whether that was a knee replacement, a hip replacement, maybe it was unexpected, it wasn't planned. Okay, so you have a 2 to 3 day hospital stay, and then you go to skilled nursing facility. Maybe they get you out of there in 10 days. Now, for those of you that maybe have a loved one who has been in Medicare or on Medicare, they probably tried to get them out of there in 19 days or under. And why is that? Because the way that the coverage works for Medicare Part A is, as far as skilled nursing facilities are concerned, days 0 to day 20 are covered at 100% by Medicare Part A. Okay? Once we reach day 21 to day 100, there is a $217 per day copay for that skilled nursing facility stay. Okay, so again, days 0 to 20, no cost. Medicare Part A covers that at 100%. Beyond that, day 21 to day 100, $217. Now that is in 2026. As with the deductible for Part A, that is going to go up year over year. Okay, so end 2026, $217 a day, day 21 to day 100. Once we get to day 100 and above, that's considered long-term care. That's going to require its own separate policy, right? Medicare is not going to pick that portion of it up. All right, so that is the quick and easy of it. Now, who needs to sign up for Medicare Part A? Well, if you are retired and turning 65, or you work for an employer that has less than 20 employees, you are required to take Medicare Part A, right? That has to become primary for you. Now, there are going to be other videos that address those specific situations, but thinking it through. Now, if you work for an employer of 20 or more, maybe there's 100 employees at your place of work, you can delay your enrollment, meaning you turn 65 and you're still going to take the company health care, so you don't have to sign up for Medicare Part A. But you can if you would like, because it's not costing you anything. It gets you in the system so that eventually when you go to full Medicare with Part B included, you can make things a little bit easier on yourself. But again, you necessarily don't have to do that. But again, you can delay that because you work for an employer of 20 or more. Okay, so again, I will get into other scenarios specifically here. This was just mainly about Medicare Part A. Hopefully you find this helpful. Hopefully you can dig through this page and find some other videos that are going to be of benefit to you as you reach the stage of your life. Thanks so much for tuning in. Look for more.